Hello everyone, I'm Dr. Stan Yeatts, OBGYN doctor with Stork Advisor. Today, I want to talk about something that has affected so many of my patients, morning sickness. In my over 30 years of practice and after delivering thousands of babies, I've seen firsthand how this condition impacts expectant mothers. Here's a surprising fact. 80% of pregnant women experience morning sickness. If you're dealing with this symptom, you're definitely not alone. Here's something that might surprise you. It's not just at morning. I've had countless patients tell me how this misleading label made them feel confused and even inadequate when their symptoms lasted all day. Let's break down what's really happening. Your body is going through a major hormonal surge, especially in the first trimester. The biggest culprit? Human chorionic gonadotropin, HCG, often called the pregnancy hormone. This is produced in large amounts to support your developing baby, but unfortunately, it also triggers nausea. Another key player is estrogen. This hormone skyrockets during pregnancy and can heighten your sense of smell, making certain foods or scents suddenly unbearable. If you find yourself gagging or previously desirable smells like your morning coffee, blame the hormones. While morning sickness is common, some women experience a much more severe condition called Hyperemesis gravidarum. This isn't just bad nausea, it's extreme vomiting that can lead to significant weight loss and dehydration. It can even affect the baby in severe and untreated situations. If you're unable to keep any food or liquids down for 24 hours, it's time to contact your pregnancy health care provider immediately. Morning sickness isn't just a physical condition. It can deeply affect your mental well-being, daily routine, and even your career. Some of these expectant mothers are exhausted from trying to maintain a normal life while battling constant nausea. If that's you, know that you're not alone. There are solutions. Beyond discomfort, morning sickness can also impact nutritional intake. Reduced appetite can lead to vitamin deficiencies. Hydration. Frequent vomiting can cause dehydration, which is risky for both mom and baby. Emotional well-being. Persistent nausea increases stress and anxiety, making pregnancy more difficult. Now let's talk about what actually helps. Over the years, I've seen these remedies make a real difference for my patients. Dietary adjustments. A pregnancy-friendly diet can work wonders. Here's what I recommend. Avoid greasy, spicy, and fatty foods. They tend to worsen nausea. Of course, you may recognize other triggers to avoid. Include bland foods. Bananas, rice, applesauce, and toast are commonly known as the brat diet. Plain baked potatoes with a little butter often is tolerated. Salty snacks. Crackers help settle the stomach acids. Protein-rich foods. If you're able to keep down the bland and salty options, nuts, yogurt, or cheese have some protein and help sustain blood sugar levels. I remember a patient who started eating a small protein snack before getting out of bed. Just a few almonds or a piece of cheese, it completely changed her mornings. Hydration strategy. Dehydration worsens nausea, but drinking large amounts of water at once can be overwhelming. Instead, try the sip and snack method. If you're experiencing morning sickness, start hydration efforts on a small scale to make sure you can handle it. Let crushed ice melt in your mouth for a slow hydration boost. Take small sips of water throughout the day. Your sensitive stomach is not quite ready to chug large amounts of liquids. As you're doing better, eat water-rich foods like cucumbers, watermelon, and oranges. Try ginger tea or real ginger ale. Studies show that ginger can significantly reduce nausea. Natural remedies with science-backed benefits. Ginger is recommended. I recommend 25 milligrams 4 times daily. This has become extensively studied. They come as capsules or even gummies. Vitamin B6, 10 to 25 milligrams 3 times a day can help, but always consult your doctor first. Peppermint or lemon aromatherapy can be surprisingly effective for some women. Now, there are prescription and over-the-counter medications available. If your morning sickness becomes severe, your pregnancy care team may recommend medications. Vitamin B6 combined with doxalamine is known as the brand name Unisom. This is an over-the-counter medication, well-researched first-line treatment, which is available. A medication called Zofran, anti-nausea medication, which is a prescription tablet. It comes available as a dissolvable tablet that just places on your tongue and dissolves where it is. You don't have to swallow anything. It's great if you're really nauseated. There are other prescription medications like Reglan, Phenergan. They can help reduce nausea severity. Remember, only take medication with the approval of your pregnancy care team. Your provider will determine what's safest for you and your baby. Some patients find relief with alternative approaches. Acupressure, pressing on a specific point on your wrist, can ease nausea. Acupuncture, some research suggests that regulation of nausea-triggering hormones is possible. Aromatherapy, essential oils like peppermint, lavender may help relax your body and reduce nausea. Again, discuss these options with your provider to know if they're appropriate for you. Now, lifestyle changes are good for a smoother pregnancy. Prioritize rest. Fatigue makes nausea worse. Relaxation techniques like deep breathing, prayer, and meditation. Adjust daily activities. Light walks and prenatal yoga can help stabilize your energy. Check out our Stork Advisor YouTube channel for pregnancy yoga videos demonstrated by a certified yoga instructor for pregnancy. You want to identify and avoid triggers of nausea. Keep a nausea diary to pinpoint foods, scents, or activities that worsen symptoms. I had one patient who realized that just opening the fridge made her sick. Her husband filled in with meal preparation until she was better. Her nausea improved significantly. Sometimes small changes make all the difference. Now, while morning sickness is common, some cases require medical attention. Seek help if you experience these things. Continuous vomiting when you can't tolerate anything in your mouth. Significant weight loss over several days from inability to eat. Abdominal pain with vomiting or fever. There are other reasons for sickness besides early pregnancy. Extreme cases may represent hyperemesis gravidarum, a condition that may require IV fluids or hospital care. Don't wait. Seek medical help early. Preparing for your prenatal visit can help. Write down questions about your nausea and any concerns. Track your symptoms. Bring a record of what triggers nausea. If you haven't felt well, weigh yourself each day and keep a record. List any supplements or medications you're taking. You might bring a support person to your appointment who can also be helpful because they can help remember details for you and ask questions you may forget. Now, morning sickness might be common, but you don't have to suffer through it alone. By making small dietary, lifestyle, and medical adjustments, you can dramatically improve your quality of life during pregnancy. Here's what I suggest. Schedule an appointment with your pregnancy healthcare provider. Don't wait until symptoms worsen. Join our supportive community through Stork Advisor and the Stork Advisor app. Get daily pregnancy tips and support from other moms. Subscribe to our YouTube channel for regular pregnancy advice. Pregnancy is a unique journey for women. The answer for one woman might not work for another. At Stork Advisor, we're here to support you every step of the way. Let's work together to make your experience comfortable and healthy as possible. take that first step today. I'm Dr. Stan. Thanks for watching. I'll see you in the next video.